A physical exam should provide a uniform approach to give information needed to make a decision on if the cow is normal or has a problem. Ensure to examine every system, including the feet and legs. The exam's goal is to gather information on her temperature, rumen, manure, metritis, abomasum, heart, and lungs. TRUML is an acronym to help remember this in English, but it is less helpful in other languages. Approach the cow examining for lameness. Lameness cows lean. If she's standing on one foot, push her a little bit to see if she shifts without issue. Quick movement off a foot indicates lameness. Fever or no fever gives us critical information. Normal is 37.8 to 39.2 Celsius. Elevated temperatures indicate inflammation from either infection or damage during calving. Place your free hand in the paralumbar fossa to feel rumen movement. Normal is 4 ruminations, too large and too small, within 2 minutes. Firm placement of the hand allows feeling this movement. Lack or slow movement indicates digestive issues. A gas cap or not a solid feeling indicates digestive issues. Digestive issues have also abnormal manure and normal temperatures, which create more than 50% of the problems that we have in diagnosis. Note the temperature to help determine if there are inflammatory issues. Palpate the udder for swelling that can confirm severe illness. Do not strip milk unless you have udder sanitizers. Stripping onto the cow's leg allows contagious mastitis to move to other teats when she lays down. Stripping your hand contaminates your hands and spreads the disease to the next cow. If you must, strip onto the floor. Run your hand down her back and feel for deflection, lack of which or pain may indicate hardware disease. Feel for pockets of air or swelling, which can indicate pneumonia or injury. Keeping your hand on the cow also keeps her calm. Many stethoscopes have a rotating head. Rotate to the side you can hear. Slide this deep underneath the elbow to listen for a clear heartbeat at 55 to 80 beats a minute. Moving to the lungs, listen in 3 places to the sound of the lung for abnormal sounds of scraping or sounds like wood cutting. Lungs are difficult to determine if abnormal, so listen to a cow next to you to see if that is normal to compare. The lungs are in the front half of the ribs, forward of a line between the elbow and the top of the ribs. The back half of the ribs are filled with the liver and the rumen. Now listen for a displacement or an empty rumen by thumping the cow with a stethoscope in 3 different spots to listen for the high-pitched metallic sound or echo that is a sign of a displaced abomasum. A lower sounding echo up high is an empty rumen or bloat. Fluid sounds with ballottement paired with a high-pitched metallic confirm a displaced abomasum. Displaced abomasums are generally high, but can also be in the area designated. Keep your hand on the cow as you move to the other side. Observe the head for eating abnormalities and fluid buildup in the manger, a sign of pneumonia. Again, listen to the heart. This side is easier to hear abnormal splashing sounds around the heart if there is fluid involved. If unsure of the lungs or heart, listen to an obviously normal cow. Normal breaths are about 10 to 30 per minute if not excited. Rapid respiration compared to other cows around her can be a sign of pneumonia, even if you do not hear other lung sounds. Heat stress can make all cows breathe rapidly. Now listen also to the intestines on the right side for fluid or air or right displaced abomasum, as on the left side. Ballottement can identify fluid, which is a sign of digestive issues. The shape of a cow's belly can also give information. Obvious bloat is high on the left side. A thin, empty belly shows inappetence. A full, gassy, and splashy belly on the right can indicate severe digestive issues. This can be confirmed by rectal palpation. Lubricate and exam rectally for feeling a full, healthy rumen or one that is empty with a gas cap or intestinal issues, which you can find with loops of intestine full of gas. Or maybe you will feel abnormal lumps. Sometimes you can feel a right displaced abomasum. If you reach far enough, it'll feel like the back of a basketball. Check for uterine discharge, that is watery and smelly. White discharge will not cause illness. Manure is the key to the digestive tract. Compare it to cows that are normal around you. undigested fiber indicates digestive issue. Manure with diarrhea can indicate acidosis. Dry odoriferous manure can indicate a cow not eating or dehydrated, and blood or black manure may mean an ulcer or hemorrhagic bowel syndrome. By following these direct, simple steps, you should have a quick and complete exam in less than 4 minutes that will give you information with other data that allows yourself into making a decision on one of the 6 main problems a cow has, or if she is completely normal.